My name is Karen Bauer. I am a doctorate of nursing practice. I'm a nurse practitioner. I've been doing wound care for about 15 years. I've been here in the Waseon area for about 7 years. I was here when we started the Wound and Hyperbaric Center and have been an integral part of building the Wound Center and the team here. I also practice at some of the area's other medical centers in both wound care and vascular surgery. So hyperbaric therapy is a cutting-edge treatment that is primarily used for non-healing bone infection and diabetic foot ulcers when we're looking at wounds. Essentially, that optimizes or makes the best of the oxygen that you're breathing in, and then changes the atmospheric conditions around you, nothing that you would feel, to then optimize how your body uses that oxygen. Oxygen is really important in wound healing, and it helps your body fight infection. So the hyperbaric oxygen is used for chronic non-healing wounds of certain types. There are a lot of things that go into making a wound hard to heal. One of them is simple lifestyle, things like smoking, having ill-fitting shoe wear, making sure that we're eating a proper diet. But when we go deeper into that, there's essentially 4 types of wounds that can be chronic or long-lasting, hard to heal. The first of those is diabetic. So patients who are diabetic will have harder to heal wounds. Patients with poor circulation or peripheral artery disease will also cause chronic or non-healing wounds. Pressure ulcers, which were formerly known as bed sores, are also difficult to heal and will oftentimes be very complex and take a long time. The biggest thing with those is trying to get the pressure off. And then something that we call venous leg ulcers, which is primarily because of leg swelling. That situation will also make wounds harder to heal.
My name is Munir Nazal. I am a board-certified surgeon in both general surgery and vascular surgery, as well as wound specialist and wound surgery. I am a professor at the University of Toledo, and I'm the medical director of the Wound and Hyperbaric Center at Fulton County Health Center. Hyperbaric therapy simply adds more oxygen to the area of the wound or the ulcer in order to help it to heal. In some cases, you cannot do much by improving blood flow. We know the hyperbaric will improve the blood flow in the form of increased oxygen to the wound. In addition, there are papers and evidence that hyperbaric will reduce infection, decrease edema, and improve circulation. We have this available at the Fulton County Health Center Wound Center.
I'm Leah. I am an RN here and the Hyperbaric Safety Director. Prior to a patient starting treatments, we make sure that they have the right diagnosis, that their insurance will cover it. And then before the patient starts hyperbarics, we go over, do some education on, nothing extra goes in the chamber, no phones, no keys, no deodorants that day, no perfumes, lotions, any hairsprays, anything like that. And then we make sure that they change clothes into our scrubs. So to help patients with kind of the anxiety and just the nervousness that comes with unfamiliar and going in something they don't know what to expect, we try to talk them through exactly what's going to happen, what they're going to hear, kind of relate to them, what they like to do for fun, what they do for work if they're still working, what they like to do in their free time. It helps ease their mind and kind of distract them from the unknown of what's going on. They're in the chamber for just under 2 hours usually, because it takes a few minutes to get to pressure and then a few minutes to bring them up, and then they have what's called an air break halfway through treatment. They come Monday through Friday, so 5 days a week. Normally we do 30 treatments total. Depending how things are going though, they could potentially do up to 60 treatments if it's needed and deemed necessary.
One thing we keep hearing about the Fulton County Wound and Hyperbaric Center, that we have a great team to work with, and all specialists needed to deal with those wounds. That is the major advantage to coming here. Fulton County Health Center managed over the years to gather a team of specialists from vascular surgery, wound specialists, hyperbaric, and other disciplines such as physiotherapy to help deal and heal with those complex wounds. I'm amazed at the fact that our team here knows everybody almost in town. They call them, deal with them, make sure their problems are dealt with. If they need help even to go to other specialists, they will do that, although this is not their job. If they have new problems, they direct them what to do. So it is a family approach to dealing with medical problems. I call it the BIS team. And I think not many places in the country having this approach to dealing and healing wounds.
Fulton County and the Wauseon area is really lucky to have the Fulton County Wound and Hyperbaric Center. We provide a much needed service to the community, and we are one of the only clinics in the area that have that specialized and multidisciplinary therapy. I am personally really proud to be a part of Fulton County Health Center because of the patient-centered care that we provide. We are able to take really great care of our patients. Fulton County has been extremely supportive of some really great cutting-edge new therapies with regard to wound and hyperbarics. Just the fact that we have the hyperbaric chamber here in Wauseon offers a really huge benefit to the community.
Our healing rate here is ranging from 94 to 98% based on the type of the disease or the type of the ulcer. The Fulton County Health Center Wound and Hyperbaric Center is well equipped to heal the most complex wounds and to deal with them.